Welcome back. Right now, we are shifting our focus to health and wellness, specifically the blood shortage. This is a huge concern to many, especially those in the medical community, as medical staff are having to make tough decisions when they don't have enough blood, trying to figure out who should get it, who should not. And that is very problematic. We have Dr. Glenn Ramsey here with us today to talk us through this. Thanks so much for being here. How are you doing?
I'm good. Thanks for having me. Appreciate it.
So talk to me more about this blood shortage and some of the restrictions for individuals who want to give blood, because this has changed.
Yeah, there's been some changes. Generally, you should be healthy and feeling well that day when you come in, at least 110 pounds and at least 16 years of age. You're asked questions about your safety for you to donate and for the safety of the people that are going to receive your blood. There have been some changes. There have been some new deferral rules for persons who are taking medications because they're exposed to someone with HIV. But some other deferral periods have been changed. So if you've been deferred for travel or infection risks, sometimes that's been changed from 12 months to 3 months in some cases. And if you've been deferred because you've been overseas in Europe for an extended period of time, that has been lifted now, so you are likely to be eligible to donate again.
And this current blood shortage, it seems that there's always some sort of blood shortage, but how is this different or the same as what we've heard before?
Well, it's very challenging in the current environment with COVID and everything. You can amaze your friends by telling them that, how often do you need transfusion in this country? How often does someone get transfused? Every 2 seconds there's a transfusion in the United States. But only about 3% of eligible individuals actually donate. And so it's really important to maintain a constant supply for our patients.
And let's jump to worst case scenario. What if there is a mass casualty event? How quickly can something like that drain an entire hospital's blood supply?
Well, most of your viewers will remember the Las Vegas shooting 5 years ago this month, where over 500 transfusions were needed in the first few hours after the tragedy. And many of those saved lives today. So it's really important to have that blood ready to go on the shelf, because you never know when something like that might happen. That blood was donated beforehand.
What are some of the most common reasons that patients need a blood transfusion, aside from some horrific mass casualty, of course?
Yeah. Well, some people just need transfusions as a one-time thing to get them through their surgery, to get them through their car accident or their organ transplant that they need to go on and go from there. Other patients need an ongoing transfusions because of blood diseases like sickle cell disease, or they're going through cancer chemotherapy, or they have other blood diseases. So there's all different kinds of situations, but they're all very important to those patients.
And Dr. Ramsey, what's your message if someone is watching this and they're maybe thinking they should give blood, but they're not quite sure? What do you want to tell them?
Well, people get a lot of satisfaction with donating. You can donate, when you donate a unit of blood, you're saving up to 3 lives with that donation. Most of us know someone who needed transfusion, or they've gone through, cancer or accidents or things like that. So you can get a lot of satisfaction out of donating, and it's really an easy process. It takes a few minutes to go through the donation process, and you find out your blood type, so it can be very satisfying.
You're saving lives with your donation. Where can we get more information about everything you talked about today?
Oh, thanks. You can contact your local supplier there and your local donor center to ask them about where and when you can come in to donate. They can answer questions for you about your being eligible. Or if you're not sure, you can go to aadb.org and find information there about where you can go to donate and information about being eligible.
Well, thank you so much, Dr. Glenn Ramsey, for joining us today. Really appreciate your time with us and encouraging us all to donate blood, because there is an extreme shortage right now. We've also talked to the Red Cross here in Utah many times, and you can find information about blood drives and how to donate through the Red Cross at their website as well. We're going to take a break and be back with more right after this.